This is a frozen image of the pelvis of a 45 years old female. She is menstruating yet with no history of any menstrual disorder. The reason for the sound is protruding abdomen and a hard mass is felt in the abdomen for the last few months. Now here I have frozen this image to show you the urinary bladder in longitudinal section. This is the longitudinal section of the uterus. This is the cervix, and this area is cervix, cervical canal. I'm sorry. And this is the endometrial canal. It's retroverted. It is in fact a retroverted uterus. The endometrial canal is taking a turn downwards posteriorly. This is the fundal region, and from this anterior margin of this myometrium, you see there are multiple tiny cystic areas interseparate throughout this myometrium, anterior myometrium, and from there you will see a hard, solid, echogenic area. This one, this is the line for it. To show you, this is the mass, a huge mass, I'll show you, and this is the lower boundary of it that does extend or communicate with the anterior myometrium. And what you see now, you can see from here the blood supply or vessels can be seen through it. Now this is I have shown you the longitudinal section, and the reason why she does not complain of any menstrual disorder is that the endometrial canal is spared by this mass that we are going to study later on. Now, first of all, let us rule out the ovaries. Now this is the left ovary. These are the vessels. And this is the iliac vessel. These are the iliac vessels. These one. Here. The ovary on the left side. This is the ovary on the left side. Let me make it clear. Yeah, this one. This is the left-sided ovary with follicles within it. Where is the right one? There is so much pressure on this on these organs from the mass. This is the right ovary with developing follicles that are in front of you. So this is the transverse section of the uterus, and you can see that the parauterine vessels are seen distended. Why are these vessels distended? It's because of this huge mass that goes up to the epigastric region and occupies all of the abdomen with vascularity, mild vascularity. It's not so much significantly vascular, it's not significantly vascular. And these are the iliac vessels. Again, I'm showing you. Here we come to the uterus, and we cannot separate. You cannot separate the mass from the uterus. Here it communicates with the uterus, clearly seen. You can see the vessels communicating. Those of the uterus. This is the uterus and this is the mass. So the vessels are communicating. Now why these vessels are dilated? uterine vessels are dilated is because of the pressure from the huge mass, solid, inhomogeneous, and you see the vascularity is because of these para-uterine dilated vessels, giving appearance of as if we are seeing varicose veins. So anyways, these para-uterine vessels are all because of the dilation, because of the mass anteriorly seen. And this is, I have just, when I move the probe, I am not doing nothing, I am just moving the probe upwards towards the neck of the patient, and here we see a mass. There are few vessels seen definitely, whether it arteries as well as veins. So these are paraesophageal dilated vessels because of the mass pressure on this on the pelvic region. So now I am going to take you to the mass, see the configuration of the mass, the appearance of the mass, the texture of the mass. Here we see a echogenic area, this one. It gives faint shadow though. Now this is a calcification within it. Okay. So calcified area is seen within it. Vessels are seen. Now this area is more vascular compared to the rest. This is a vascular mass, yes. You can see abundance of vessels now with powered Doppler. Let me apply some gel. Now I have placed the probe in the epigastric region and I can see the mass straight away. This is the epigastric region. Here you see, this is the IVC. This is the IVC and this is the mass, and the IVC is entering the heart. This is the cephalic region, cephalic part of the IVC. And this is the aorta. Aliasing, too much aliasing is seen because of the angle. But anyways, this is the aorta instead. Here, and this is the IVC. This is the mass. Now from the epigastric region, it's a heterogeneous mass with few solid elements within it. Or calcification rather, I will not say solid element. This one, this area. So it's a vascular, heterogeneous, solid mass seen extending from the pelvic cavity up to the epigastrium and then extending on both sides of the midline. Now I am And this is the source muscle on the left side, and you can see the mass over here. This is the spleen, normal. The kidney is okay. No mass effect on ureter is seen, as the kidney is not showing any hydronephrosis. Now on the right side, well, this is the liver, the gallbladder, portal vein. Okay, this is the kidney on the on the right side. Just a minute. Yeah, here we are. So no significant effect on the ureter on the right side even. No significant dilation of calyces is seen. No focal element seen in the liver. And here is our area studied, mainly aorta. Let's review. So there it is. Now, what can it be? Had I not seen the ovaries, I would have considered it as an aggressive mass of some aggressive nature. But as we did so, both ovaries are intact, and therefore I will rule out any aggressive pathology. Secondly, had she been pregnant, we would have considered beta ICG level had been raised. Then the differential would have been that, see, the appearance is very much like that of retained placenta or high dentiform mole, but as she is not in that age group and there is no history of this sort, her last baby is of 15 years of age. So, and what goes in favor of a fibroid, a large fibroid, huge fibroid, occupying all of the abdominal cavity, is that we see calcification within it. We also see calcification at its low border here. See, this is again a calcification. This is a calcification. This is a calcification. So this is our case of the day of a huge fibroid, and occupying all of the abdomen. This is the indication that it's extending on both sides of the flanks, that this is the spinal cord, this is the spine, and this is the mass. Thank you very much.